sponsored by St. James School of Medicine for COVID-19. And I'd like to introduce the panel that we have. So first there's Dr. Ramirez, Dr. Jose Ramirez, who is the Dean of Administration. There's Deanne Kentis-Rogers, who is the Minister of Education. There is on my right, on my left, there is Dr. Alice Webster, who is the Chief Minister and the Premier. Next to him is Dr. Aisha Anjuin, who is the Chief Medical Officer. And finally, there is Mr. Foster Rogers, who is the Permanent Secretary for Health. I'm going to turn this over to Dr. Ramirez, who is going to present the slides for tonight.
Good evening, everyone, and thank you again to the government of Anguilla for this invitation. We know that soon the borders will start to open, a soft opening on November the 1st, and we just want to help the community in Anguilla and be able to be safe. Safety is, I think, is the biggest priority for all of us, for our relatives, our child, and for our elderly. So it's really important for us as a med school with really strong ties with the community to bring this information to Anguilla and the people abroad. All right? So we will discuss this evening some concepts that probably some of you already know. Some people will ask relevant questions about the disease, this viral infection, and also I hope that the panel will answer all the relevant questions regarding coming to Anguilla from the November the 1st. Okay? So first, we need to define what is COVID-19. Okay, so COVID-19 is the most recently discovered coronavirus. Coronavirus is a family of viruses that live in birds and other type of animals. And in this case, we have what we know as a zoonosis, a transmission from animals to humans. In this case, the COVID-19 is named 19 because it was discovered in the 2019. All right? So this virus started it was an outbreak in China and then it spread all around the world. And right now we have what we know a global pandemic. Other things that are really important to remember are the symptoms and what type of patients we will see in our communities. The symptoms that you will see usually should be mild symptoms. Also depends on your immune system. If you have a weak immune system or you have any type of disease that can affect your immune system, you're a person, you're an individual that is in risk to suffer a little more strong reaction against this virus. Or the virus will attack you in a different way, okay, in a stronger way. So the basic symptoms are fever, dry cough, and tiredness. Also, are not exclusive. You can find, it's going to sound kind of out of the concept of a respiratory virus, but you also can have diarrhea, loss of taste or smell, rash on skin, and discoloration on fingers or toes, okay? These, as I said before, these symptoms are really, really mild, with the exception of certain people that will react in a really strong way because of a weak. Okay, what should I do if I have COVID-19 symptoms, and when should I seek medical care? Usually, as I said before, the mild symptoms this type of people should remain at home, and they should be self-isolated inside their home because they don't want to spread the disease inside the household. We have other especially in the Caribbean, South America, and during the summer, we have other endemic viral diseases as dengue, chikungunya, that can affect the population and can lead to have symptoms as fever, okay, as the main symptom for these viral infections. So if you have a really high fever, you should look for help in with your local health authority or your family doctor. Right now in Anguilla, we have the COVID-19 hotline. The numbers are in the screen, 476-7627. You can also type SOAP on your phone. And 584-4263 hand, okay? Easy to remember. How does COVID-19 spread? And this is really important, especially in big communities where people do not pay attention to, I can say, basic hygiene procedures, all right? Simple as just wash your hands and keep distance should be more than enough to avoid infection, okay? So in this case, when a person that is infected talks to you, these little saliva droplets containing the virus can reach you, but they have a specific weight, so the distance that they can travel is not that far enough. That is why if you're more than 3 feet away, 4 feet away, or in this case, 1.5 meters, you must, all right? Also, we need to remember that if we have people with mild symptoms and they find themselves going out of their quarantine place, they need to wear a mask, okay? Because it's not about you that you have mild symptoms, it's about that you need to protect the community. It's about community, it's about to care about your neighbor, all right? That's the most important thing that we need to remember. We need to protect our fellow citizens. People can catch COVID if they breathe in these droplets from a person, as I said before, infected with the virus, and also if these people is touching certain surfaces, and then you touch those surfaces, and then you touch your face, your eyes, you can get the infection. That is why it's so important to wash your hands or use alcohol-based gels for cleaning your hands, okay? When you don't have water and soap. Can COVID-19 be caught from a person who has no symptoms? This scenario is really difficult to explain. Remember, this is a new disease. We're still studying the disease. We don't know how the disease behaves on the 100% of the time, all right? And every person, we need to remember that every individual is different. So the disease can be transmitted from child to grandparents, or could be from a person who works with you that has basically no symptoms, just a small cough, and that can spread the disease. So that is why it's really important to remember to wash your hands and to keep distance. In this, some reports have indicated that people with no symptoms can transmit the virus, but until today, we don't know how this happened. How can we protect others ourselves if we don't know who is infected? Okay, as we know already, after being into this pandemic since March, especially here in Anguilla, we know that we need to have hand and respiratory hygiene. Is the basic norms of just washing your hands, keep the distance, and if you think that you have the symptoms, please wear a mask. Basically that, all right? Keep the distance of 1 meter, that is 3 feet or around, this is from the WHO, the CDC recommends 6 feet, that is around 2 meters. It's more than enough to avoid to breathe the droplets from the other person. Since some infected persons may not be yet exhibiting the symptoms, or symptoms may be mild, the other thing that we need to remember is just to keep distance. So far we have been talking about washing your hands, keep distance, and if you know that somebody in your house or some neighbor, especially in your community, has the COVID, please remember to wear your mask. What should I do if I have come in close contact with someone who has COVID-19? If you have been in close contact, probably you may be infected, all right? So keep that in mind. If you have somebody that has the virus in your place, in your house, or in your job, probably you got the disease. Close contacts mean that you live with or have been in settings of less than 1 meter from those who have the disease. Okay, so in this case, it's better to stay at home. Can children or adolescents can catch COVID-19? Yes, they can have it, but they won't present symptoms. Can be there like asymptomatic carriers. Some of them can have the ability to carry the virus and to spread the virus, all right? But they won't get a severe disease. We have small numbers of patients around the world, and these young people, some of them, as you know, have died, but it's just a small percentage of the total population of the world. And usually these young people has other conditions related to the immune system. The children and adults should follow the same guidance on self-quarantine and self-isolation if there is a risk they have been exposed or are showing any symptoms. What can I do to protect myself and prevent the spread of disease? I think that we here in the auditorium, we already know what to do. All right, stay aware of the latest information of the COVID-19 outbreak on your community, in your state, in your country. In our case, we're a small but strong island, okay, a small country, but really strong. So we know how to prevent this. We just did it a couple of months ago. We keep social distance in every single business. We did isolation for 1 month, okay, and we saw the results were 100% effective. We only had 3 cases in this whole time with COVID. So I want just kudos to the government. Thank you so much for protect all of us during these really difficult times. Again, as I say again, just to close, wash your hands, keep distance, avoid crowded places, avoid touching your eyes, nose, and mouth. Make sure that you and the people around you follow good respiratory hygiene, and by that, remember, sneeze on your elbow. Try to avoid physical contact. We remember at the beginning, in March, every single one of us were using the elbow touch, okay, as for other diseases. So we can probably, during the reopening, until we adapt to this new era, to go back to the same principles. Stay home and self-isolate, even that the minor symptoms such as cough, headache, or mild fever until you recover. Remember, it should be around 10 to 14 days. Also, you need to have a negative test. How long does it take after exposure to COVID-19 to develop symptoms? Usually it's going to be 5 to 6 days, but it can range from 1 to 14 days. So in the case that you think, oh, I don't have it, you need to be careful with that. One frequent question that we have been listening a lot around the island is, do I need to use antibiotics? Remember, the antibiotics were designed to fight against bacteria, and this is a virus. This is just a particle of protein, RNA, and antibiotics, they don't work on viruses, all right? It's just for bacteria. in which case a doctor will prescribe a antibiotic in case of an overinfection. You have a viral infection, and then the bacteria use this as a route to get into your lungs and causing an infection. So you will have a viral infection plus a bacterial infection. In that case, yes, antibiotics are indicated. Does the WHO recommend wearing medical masks to prevent the spread of COVID-19? As we said before, if you keep enough distance, you wash your hands, you don't touch surfaces, and you don't touch your face, you will be probably safe, all right? So regarding the mask, if you have in your community any given case of COVID, probably the safest thing to do is to wear a mask. If you go into the supermarket, it is going to be a closed space, wear your mask, etc. Okay, the bank or any other stores. How long does the virus survive on surfaces? It depends on the surface, but it can live until up to 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. That is why we need to wash our hands. Okay? So for the most recent guidelines, updates, and information on Anguilla's response to containing the COVID-19 pandemic, please visit www.beatcovid19.aa. All right? Thank you so much for your attention. And please, I invite you to type your questions on Facebook, on the website, and for the in Anguilla and St. James School of Medicine. Thank you so much.
Okay, thank you very much. So far, do we have any questions that have arrived? Does anybody in the audience have any questions? Yes? What? Okay, the question was, what is the effect of gargling with a saline solution on COVID? So COVID is not going to be affected by this. It may give you some symptomatic relief to gargle if your throat is sore. However, it will not eliminate the virus or decrease your chances of being infected. So the effect is symptomatic.
I think what we can say about treating the virus itself is that there's no full treatment or cure right now. There are a lot of experimental stuff, and certainly people are approaching it from different angles. But as of now, there's basically some therapeutic response to it, make you feel comfortable, try to reduce fever and those type of things. And I think if you were listening to what has happened recently to President Trump, they're using some steroids and so forth to boost systems, but there's no overarching treatment as yet. But the reason why hygiene is so important is because the protein skin that encapsulates the virus, it is so amenable to simple soap and water. The simple regular soap and water can just kill it. And certainly that is the best way to deal with it. Proper hygiene, proper cleaning, certainly trying to keep your social distance so you don't get infected with it in the first case. Because the way to deal with it is so simple. Simple soap and water can disrupt the protein capsule and then it just dies. Because as you know, a virus cannot function outside of a human or some other host body. It's not something that can survive on its own. So once you find a way to disrupt the virus itself, it's not viable after that.
Okay, so the question was whether or not soaking or being exposed to the salt water in the sea will affect your transmission or the illness associated with COVID-19. And to my knowledge, there is no evidence to suggest that doing these things is going to either decrease your risk of developing the infection or alter the course of the disease.
To that, remember that the main way the virus is spread is through close contact you will get with a person who is infected, so the droplets, the respiratory droplets. So once you have gotten that into your membranes and so on, you can go in the sea and soak afterwards, but you can see logically where that would not provide any protection at that point. So that's another reason why that would not be a protective mechanism at all. The best thing is, as Dr. Ramirez said, is the physical distancing, the hand hygiene, and so on, in order to protect against the virus. And from our perspective of our government is to prevent onward transmission in the community in the first place, and to continue to keep the community safe, even as we are forced to contemplate coexisting with the virus and opening up. So that's why we are taking this juncture now to reinforce those messages, to say that whatever we said 3 or 4 more, 6 months ago, losing track of the time, still holds and still pertains more than ever. The difference is that 6 months ago we were hoping that everyone would have gone on their lockdown and emerged virus-free. That has not been the case, so now we are forced to reconsider an existence that has to contemplate COVID-19 being around for a while. So those are the things. And as Dr. Ramirez said, we've done it before, and the basic scientific principles have not changed. We just have to get our minds around the measures that will keep us safe and will continue to keep us safe.
Yeah, so the pervasive message here is to prevent the disease and to prevent transmission by exhibiting proper hygiene, keeping social distance, washing your hands frequently, and wearing a mask when you go to areas where the density of individuals is higher, where there's more people who are aggregating. Okay.
Okay, we have some questions from our own medical students. They're asking when the borders will be open for them to return to normal lessons and to be here, because they love Anguilla.
They are already, and actually several students are applying already and have dates. I think this week we have a few students coming in, and if I'm not mistaken, some students have come in already. We have opened, but the concept of this opening, like pre-COVID, where it's open as you can just get on a flight and come to Anguilla, or to most countries around the world for that matter, that is not the case at the moment. What we have is an application process that safeguards the community by ensuring that persons have a test 3 to 5 days prior to arrival, an algorithm that ensures that you're tested on arrival, and at the end of some period of restriction of movement, that will be predicated on whether you're coming from a high or low prevalence. And also, in addition to that, the usual measures, the precautionary measures that we spoke about. So students are welcome to come back. Anguilla is open, but it's not a free-for-all, unfortunately, and that is not the case in most countries. So we are still doing our testing and so on. I would like to take the opportunity to also share in terms of what we've done before and what we're doing going forward. We've been successful. We were successful 6 months ago doing testing, isolation, quarantine, contact tracing. Again, those measures still pertain. What is exciting that fast forward 6 months, we've ratcheted up those responses. Now we have pre-test requirements that nobody did before, so that has also kept us safe. We have a very regimented quarantine that's very controlled and very regulated by monitoring and surveillance in the field, which we've done before. We've had extra staff to improve that even more and to make the community feel more safe and in effect to be more safe. And we've also improved on our testing. A few months ago, we were solely dependent on CARFA. Somebody had to get on a boat and get the samples to St. Martin and then send them by FedEx. And then it took us, remember, the 4 to 7 day turnaround, and people were waiting on the results. And if you took too long, people were suspicious and all this. So we moved away to where we're testing on island with a 1 hour, 15-minute turnaround time for results in terms of the testing. And we're also opening up another platform with the assistance of Public Health England to increase the testing even more with another machine. So whatever we're doing before, we've actually improved upon going forward. But once again, for the next few months, for the foreseeable future, for the next few months until there's a vaccine or till there's an improvement in the pandemic globally, we're still having to go forward very carefully because we do not want to be in a situation where we have local transmission or community transmission, and we feel we're in an even better place to do that this time around with the support of the community, including the persons who are undergoing trainings right now to receive guests and to receive repatriated persons, including the persons who are under quarantine that must adhere to certain rules and restrictions, and including yourself as a public to educate yourselves, to be well sensitized, to understand the existential threat that this has become, and that we need your cooperation in making this a success, in understanding that we have moved to a different paradigm, in that we cannot avoid the virus for the next 6 months to a year, but we can certainly live with the virus safely. And also that will require your commitment and your cooperation as well.
No, we're just open to questions here. Any other questions? Yes? Okay, so the question was about the protocol for treatment for COVID-19. And do you want to take this, or do you want me to take this?
There are a number of drugs on the market in terms of experimental drugs for treatment of COVID. One of the most promising is dexamethasone. The good news is it's a common steroid that's been around since the 60s, 50s, and so on. It's very effective in actually reducing mortality, which means that it actually reduces deaths. And I think President Trump was on that amongst a million other things. But we've seen that drug, I'm saying that because that's actually good news, because it's a very commonly available cheap drug. So that is also in the protocol. The drug remdesivir, there's going to be an access issue early on, and there's still a debate on whether it actually, it could shorten the time you're in the hospital, but there's still a debate on how much it actually impacts death. There are a number of other drugs that have been around from time immemorial as well that are under investigation. So that looks very promising because they're seeing that it's the body's inflammatory response that is really killing people. So that's good news, but we will always preach prevention. We don't want to get to that point. A lot of these drugs have not been approved. A lot of these things are still at the research phase. We're still waiting on an effective vaccine, and it is not a cliche to say prevention is better than cure. We also know that we have capacity now, I didn't mention this. A few months ago, we didn't have an isolation unit. Now we have a temporary isolation unit, but we don't want a single person on a ventilator. You know, your chances of coming off that ventilator, even though are much slimmer, and so on. And you have 1 or 2 persons on a ventilator in any system, you're easily overwhelmed in terms of the human resources and the drugs and so on. We are not contemplating getting to that point where we have a lot of persons that would need hospital care. And the way to limit that is to limit the spread of the disease, even if we get 1 or 2 imported cases through persons that are coming back for whatever reason. We can do this thing through prevention, and we are not even contemplating a protocol that we will use often enough, because it's just not good practice. I mean, prevention really is better than cure, never as before. So we do not want to be in that position to contemplate those things, to be quite frankly. But that would be the...
Yeah, so
Yeah.
the decision on the treatment is based on clinical picture, right? How sick the person is, what comorbid conditions they have, do they have other diseases that affect their immune system, as Dr. Ramirez discussed earlier, that may make the infection more severe in that particular individual. So these are the decisions that will, or the factors that will help make the appropriate decision on an individual who has the infection. Not everyone who comes in needs dexamethasone or needs to be hospitalized, but those that do, the clinical picture will determine what is the best approach.
Yeah. And we're also seeing that there's still a case where 80% of persons will be mildly affected and so on, but the other 20%, I mean, you don't want to be in that 20%, so there's also that, and there's no cure at the moment, so hence the need for prevention in addition to what Dr. Ilya is saying.
Okay. Yes.
You mentioned the period of isolation or quarantine. I'm not quite sure. Is it on? And it sounded like it varied. There was some variance in terms of the times. Could you elaborate on that in terms of how many days for this set of people versus how many days for another set of people?
It's okay, so once you have been exposed to the virus, there takes anywhere from 1 to 14 days for somebody to develop the symptoms. And so not everybody develops the symptoms at the same time. Typically, most people will develop the symptoms within the first 5 to 6 days. There can be individuals that have been exposed to the virus that don't develop the symptoms until 10 days after their exposure or 12 days after exposure. But most people who are exposed develop their symptoms, in 6 or 7 days. The problem is, though, that there seems to be a possibility that that person, even though they haven't developed symptoms yet, may be contagious. In other words, may potentially transmit the virus before their symptoms develop. So this is based on viral load and on a number of other factors, but the important thing to understand is that if a person has been exposed, it may be possible for them to transmit it before they start to develop symptoms.
I don't think I was clear. I'm sorry. I was trying to get to the point of entry into Anguilla, and what the variance is for different groups of people coming from different places.
So you can
Are there different time periods for various locations, or is it the same?
So what Professor Ilya was in fact describing was the rationale for the classic 14-day quarantine period, because that's a period when you expect a person would develop symptoms and so on. What we've been able to do with testing, if you're coming from a lower risk area, is to reasonably and safely cut down the quarantine period, right? So that's why we say we test you on day 1 and then day 14 of a quarantine if you are coming from an area of higher prevalence. So we leave you with the full 14 days. However, we've been we've learned along the way that with testing, if you're coming from a low-risk area, it's possible to cut that to 10 days and still have a 97% capture of persons who would have become positive. But that's only persons coming from low-risk areas. And we're using a 0.2 prevalence because that's based on some modeling that Public Health England has done. And why? Because it's a resource issue. In addition to the fact that quarantine is a bit stressful for persons, it's a restriction of your liberties and movements for a period. So any way we can reduce that safely, that is exactly what we have done. So we're using the 10-day mark for low prevalence places because it still gives us 97%, which is almost 100%, right? Otherwise, you're up to your 14 days, unfortunately.
I think also there's no test globally that can test for the virus the first day of infection. It's just not possible. It's just not right now. In fact, if you were to get infected today, the false negative rate is almost 100% for the first day. In fact, with all the testing we have currently, false negatives never really get below 15-20%, depending on where you're coming from. So the two testing protocol protects us. The first test on arrival, and then we do 10 days after. If you come from low prevalence, that gives us, as Dr. Aisha said, 97% predictive value, and then a 7% capture rate. So basically 3%, we could live with that. It's a figure that certainly is not really, significant statistically. However, everybody who is out of that low prevalence rate will go to 14 days, because the evidence is after 14 days, even if you were to get it, and day one coming in, after 14 days, you're not really infectious. You can have bits of the virus in you, you can have pieces of RNA, but you're not infectious. And when we say RNA, all a virus does, all it does is multiply, it does nothing else. It just multiplies and then it survives that way. So really and truly, the 10-day test is for us to rule out anybody coming from a low prevalence that we can ease them out. Now, when testing gets better, it's possible we can drop that down lower. If testing gets more sensitive, when the sensitivity picks up the number of positives, if sensitivity increases for a lower yield, we possibly can bring that rate down to less than 10 days. But right now, the science has indicated that 10 days is the maximum, or the least we can expect from low prevalence countries.
Another important point that we do here, that you're not left to your own vices while on quarantine and so on. There's monitoring. So we're not just testing people and standing back. We check temperatures, we check for symptoms throughout. So there's also that as well as part and parcel of the surveillance that we do. So that if you have that 3%, most persons will become symptomatic at some point. So there's also that backdrop, testing of symptoms and testing of temperature and so on. Very rigorous surveillance that we are doing.
One of the things that we've learned from other islands who have done testing, right? If you drop less than the 10 days, it can create some serious problems. Because then you're releasing people in the public who can be infectious, who then can spread it to the community. For instance, after 5 days, we pick up 76%. After 4 days, it drops to 66%. After 3 days, only 40-something% you pick it up, right? After 7 days, I think it's 8 days, like 93%. But we are not comfortable with flipping a coin at 50%. So really and truly, when you find people are pressing you to release after 5 days, it's like tossing a coin, and that's not science.
So I just wanted to touch on the social aspect of all of this. Anguilla has been very fortunate in not having further cases of COVID since March of this year. And a lot of members in the community have been able to have their fun. We've been able to have some carnival events. And we are now seeing, as we go into the reopening phase, that what we're trying to do is encourage people to pick back up the habit of practicing hygiene, practicing safe hygiene, washing their hands, keeping their distances where possible. So we're now in the phase of trying to encourage people back into proper habit forming. So this session is part and parcel of trying to get the community aware and back in the habit of practicing social hygiene, washing your hands frequently. Because once you live with that type of freedom for a long time, sometimes you can become comfortable, and we want to reinforce the fact that we are going to be living with COVID and that we want our people to get back in the habit of being careful and putting safety first.
Thank you. Oh, yes.
I have 3 points I would like to get clarifications on. One, it is said that younger people develop an enhanced immune system when they get the virus. So you've got to have something to sort of bring it down. And then in some cases, they have been using interferon to boost the immune system. And in another case, they have been using something like a coumarin type of medication, which has a bonding site, like has 2 bonding sites for the virus. But when you use the steroid, it has an additional bonding site. So what I'm asking is whether or not your the local facilities would have interferon available if it becomes necessary, and what do you have to actually tune down the immune system for a young person, let's say 20, 30, 40, who might be infected?
You want me to take this? Okay. So, thank you. So the question was whether or not young people had an overactive immune system or a very powerful immune system that may cause a problem, and whether certain medications such as warfarin, interferon, and what was the third? And yeah, heparin may be part of protocol to address this. So let's first address the issue with the immune system. Your explanation of that young people had a more powerful immune system may be looked at a different way. Older people have a less active immune system, which is probably a more accurate way to portray it. Young people or people of middle age do have an effective immune system if they don't have any other pre-existing conditions, any other comorbid conditions, other diseases that impair the ability of their immune system to work properly. But as you get older, and this is true of almost everybody, as they get older, there is something called immunosenescence, which means that their immune system starts to work less and less effectively. And so this may be one of the reasons why older individuals may be at greater risk for developing severe disease and succumbing to it. But it is true that there are some problems associated with an overactive immune system, and there are some complications that may develop in a small percentage of the population from this type of infection. So there's clotting issues that have been made aware in the news and in medical journals and so forth. That can be addressed by giving blood thinners, but that would not be something that doctors would prescribe routinely to people who have COVID-19. I think that that may be a situation that only will be prescribed if and when the clotting problems are discovered in a particular individual who has that infection. Similarly, the dexamethasone and other immunosuppressants can be given if and only if it is deemed necessary in that particular case. This is not something that will be, that should be prescribed routinely to individuals who have COVID-19, but may be reserved for those who display particular symptoms that would indicate the need for that particular treatment plan.
I think the message you want to get across is we'd want to avoid getting to that point. Most of the treatments that President Trump has had over the past week, not even people in the US have access to some of those treatments, right? Moreover, us here in Anguilla, we don't have access to experimental stuff. We don't have access to a lot of these therapies that are so-called out there. So I'd want us to take keen interest in the prevention issues. As a public health person, I think our first step is to ensure that we don't get to a point where we need those things. In fact, I can guarantee you that if persons were to need some of those here in Anguilla, it may not be absolutely possible to get some of those experimental treatments. We just won't get them, right? So I want us to be very clear that the message from the ministry itself is yes, at some point in time, we will get persons who are sick in Anguilla. The issue is how we control that in a way that it doesn't spread to the population. If indeed it does spread to the population, how do we treat with those who come sick? And it should be, yes, we do have our facility there, but we hopefully won't get to that level. And just to put it simply, there are different ways to treat a disease. And in public health, we use a simple epitriad: the agent, the host, and the environment. And we attack diseases from different levels. Most of our stuff is attacking from the environment. Cleaning your hands, social distancing, making sure that you don't spread it. Some of those medications you speak about can attack either the host or the agent. You either stop the virus from replicating, or you bond stuff to the virus that stops it from attaching to the lungs and so forth. Or the host, which it boosts your immune system to fight it. So I don't want us to get too caught up with those sort of complicated and technical stuff, but simply to say, from a public health standpoint, we feel the best way to deal with this is to ensure that we have the prevention stuff in place so that don't go on that route of experimental stuff. And people in Anguilla won't take them anyhow.
Yeah, so Mr. Rogers, your point is well taken. So prevention is worth a pound of cure.
Okay, excuse me. I have several questions from the Facebook. Right now, the first question is, where do you get tests if you are leaving Anguilla?
If you're leaving,
Anguilla.
if you're leaving Anguilla.
Where you get tested, so at the moment there's an administrative fee that is paid at the hospital. It's $100 US. And then you make an appointment to come to the Ministry of Health to get the swab, get the actual test. The persons need to coordinate this with their travel plans and the different requirements of the airlines or the country they're heading to. Some airlines will give you 3 to 5 days, likewise some countries 3 to 5 days or up to a week. So that's the sort of thing that the person has to know in order to time when the specimen is taken. We're typically doing the sample taking for travel purposes to leave the island around 8 in the mornings, but it's best to call ahead and get the appointment. And that's how it's been going thus far. But you have to pay the fee first at the Princess Alexandra Hospital, and then come with your receipt to get swab. And the results are available within the morning, usually. Certainly within the same day, and that depends on how many tests we're running that day, how many batches, but certainly within the same day you will get the result.
Okay, thank you so much. I have another question from Junior Gums. Is Anguilla charging a fee for students and residents? And if so, why and how much are you charging? Do you plan to waive this for the students and residents who have a home in Anguilla that go and come 2 times in the month to take care of their property?
The fees we are charging are basically for the tests. We have to administer the testing services. So when persons come to Anguilla, we have to do 2 tests, one upon entry and then one upon clearing quarantine. So we charge you for those tests. And we also charge you for any public health surveillance that needs to be done during that period of time. whether, as you know, if you're in quarantine, you pay for quarantine fees, which will cover your stay, your accommodations, and your meals, and certainly the surveillance while you're there. If you're home quarantine, you still have to pay for your 2 tests, your test as you enter and the test as you clear quarantine, but there's also public health surveillance. Once you go to home quarantine, you just don't go there and stay for 10 or 14 days. Our nurses come and check you check your temperatures, I think 2 or 3 times if it's 10 days, or if it's 14 days, it's 4 or 5 times. So we monitor you during that period of time. So it's not simply you go home and you stay there. It's critical that we not only monitor, but if somebody comes up positive, we catch you early, right? So we're not charging fees that are exorbitant. We are charging fees basically to cover the cost of the services.
Thank you so much. To keep on the loop with those type of questions, I have another one. Can you define government-approved quarantine location? Is there a specific place travelers must stay or pay for? What if you have a personal residence? Would be that acceptable?
Yeah, there's actually an assessment that's done. There's an assessment that's done based on a checklist to determine the suitability of the accommodations, but the other consideration is the risk at the time, looking mostly at the epidemiological situation from the country that you're coming from. Again, using that 0.2, so if it's high risk, high prevalence, community spread, and you know the cases are increasing, you are less likely to be allowed to quarantine at your home. Why is that? It's just a risk assessment, because if that such a person gets loose in the community and breaks quarantine and turns out to be positive, there's much likely the threat of community spread. So it's just based on that, versus somebody who is coming from a low prevalence area, may misbehave, may break quarantine, but that person is less likely to be positive and less likely to spread infection. So that's the rationale behind that. Besides that, we have the government facilities that you are well aware of that are manned by the nurses and police constables.
Thank you so much.
Okay. We have one last question.
I'm sorry, but I write for the Daily Herald, and there's all kinds of questions and information that we want to pass on. So pivoting slightly to November 1, when guests are allowed into the country, they still have to be quarantined, though. Soft quarantine, I think it's being called, correct? Stay in place quarantine. Just stay in place, okay. So, but they have to stay in place for that period of time. Okay. So our Anguillian workers at the stay in place location, how are we protecting them, or how will they be protected in case there's someone that pops up positive? Will there be periodic preventive type testing for them, or if you could just elaborate on that for me. Thank you.
You're speaking to persons who work within the hotel environment. Each one of the hotels have to present a number of protocols and standard operating procedures. Then we will certify that particular property. Once it's certified, also there's training, a rigorous amount of training that will be conducted by the hotel. And we are hoping that everyone will be vigilant and everyone will follow the protocols. And if everyone follows the protocols, the risk is extremely low. But we've had instances, we've had an example in Barbados where someone breached protocols and we saw what happened. So it's incumbent on everybody to take personal responsibility who work within the hospitality sector to ensure that you follow the protocols at all times and just don't relax for any reason. We know that Anguilla is a country that has a high number of repeat guests who is very familiar with those persons who work in a particular hotel. The temptation to shake hands, to hug, to kiss may be there. And we have to be able to respectfully say, no, it's not allowed, and all of that will be captured in the protocols that will be established, that are being established and have been established for each particular property.
Just to supplement what the minister said, we have started conducting psychosocial support training for those who are in the hotel industry, who are working in the hotel industry. And part of that psychosocial training would have also involved some case studies dealing with what would happen if. So the workers would have been presented if somebody wanted to come or approach them in a way that would break protocol, and talk, just to really talk about what to do in that particular instance. So we're trying to capture as many of the instances that could potentially happen and to be able to leave the workers feeling assured that they're going to be protected in these circumstances.
Just to add to that as well, one of the things that we have learned, given the fact that we've been COVID-free for a number of months, we have been able to look at what other destinations have done, what other jurisdictions have done, the mistakes that they have made, whether it be releasing early from the stay-in-place, or quarantine, or whatever you may call it. We have seen the mistakes, and we have been able to learn from those mistakes and to mitigate those mistakes. You just don't repeat them, because you see in the end result. So I know a lot of persons may think that our protocols are quite rigorous, but they're like that for a reason. Unless, Trump would share his secrets, we're going to continue to adhere to those protocols for the foreseeable future.
Yes, I also think we've had quite a bit of experience over the last few months that we are now beginning to share with the hotel industry. We have so far repatriated 450 persons since June 16th? Early June. Through our testing protocols, to taking care of them on site, to ensuring that, they're being well fed, they're being taken care of, and those type of things. To date, we have not had one positive case since we've opened repatriation, right? Even if we had a positive case, our protocols were such that that case could not spread. We've had people working there. Anguillans have been working in these quarantine sites since June, all right? So we are hoping that this type of procedure and these type of protocols will be moved to the hotel level and they stay in place. The minister don't want to call it quarantine, but the stay in place is basically a version of protection of environment that allows us to manage if anybody were to show a positive. So the trainings that we have with staff, we've had trainings with hotel staff so far, boat operators, taxi drivers, and so forth, because at the end of the day, our economy is 70 to 80% tourism. And as much as we like to be able to stay shut down, we cannot stay shut down. And the message I want to get across to Anguillians, we have survived the balance since May, June this year, based on $100-something million that were given by the British government to assist in budgetary allocations. We are still trying to figure out how we're going to get some assistance for 2021, knowing that we still won't be back up with our tourism industry. The question is, what pound of flesh are we going to have to pay for that extra assistance? All right? So we got to find a way to open this country. At the end of the day, Anguillans are very resilient and independent-minded people. We have to find a way to open the country in a way that allows us to feel proud and independent again. We cannot be consistently depending on Her Majesty's government to bring up shortfalls in our budget. At the end of the day, that is not what Anguilla is about. Anguilla is about ensuring that we meet our own demands, that we take care of ourselves. And even though we appreciate the fact that because of COVID, the British government has assisted us, thankfully, we can't stay in this situation forever.
You formulate your questions. To add to the Permanent Secretary, what the Permanent Secretary have said is that even though that assistance may have come and may be coming from the British government, anyone can appreciate that $1,000 in terms of COVID relief really doesn't go that far. So how do we open Anguilla while ensuring the public health of the citizens of Anguilla? So that delicate balance have to happen. And while that delicate balance is happening, we also are cognizant of the fact that pre-COVID tourism arrivals will not happen in the immediate future. So these are the things that we have to wrestle with, and these are the budgetary situations that we have to wrestle with, knowing full well that our largest employer is the hospitality sector, and a significant amount of our people will not be employed because it'll be based on a needs basis. And I don't see the hotels, even for the festive period, being at 100% occupancy as it was in 2019. So these are the things that we have to wrestle with and see how we can maximize the benefits of reopening the way we are reopening while ensuring public health safety.
Okay, everyone. I want to thank this panel. We do plan to have. You have another question?
Yes, sorry.
Oh, sorry.
I have from Maxine, when will Anguilla start using the more modern COVID PCR test and stop using the deep insertion nasal swabbing?
We are using the PCR.
There you go.
Maybe she's talking about the antibody test, which is.
Yeah.
We are actually using top-of-the-line PCR
Yeah,
stuff.
we're using the
We're using stuff that the private sector can't get. No, be honest, we are using stuff the private sector cannot get. In fact, the stuff we are using, the British government had to go to the manufacturers to do specific stuff to get us this stuff because the private sector just can't get it. So the stuff that we are using is just top of the line.
And on top of that, the time frame in which we turn around COVID results is unprecedented.
Yeah.
If you go and get a test anywhere in the US, it's not going to turn around in less than an hour. We can turn around test results in less than an hour. You know, we are superior in a number of aspects.
There you go.
I think there are quite a bit of misinformation about rapid tests and saliva tests and antibody tests and antigen tests. There's a whole lot of stuff out there that if you go on the internet, you can get confused sometimes. We at the ministry try to muddle through all of that to ensure that when we come to the public, you can have some confidence that what we're doing is the best that's out there. And that's what we try to do.
And that reminds me to encourage the public to take their information on COVID-19 from official sources. So the WHO, the Ministry of Health and Social Development page on Facebook, the Beat COVID-19 AI website. I'm begging people to please take your information from reputable sources, because the worst thing that we have noticed in this 21st century is misinformation. And misinformation is part of what has caused this pandemic to be as drawn out as it currently is.
So, it's, been about an hour now, and we certainly want to wrap it up, but as you can tell, we have to open, and we've gone from where we were in lockdown completely to a soft opening to now phase 2 opening, where the villas are certified for guests. The hotels now will be certified for guests after November 1st. These protocols have been put in place. They're following protocols that are not only here in Anguilla, but some that have been informed by universities and other entities around the world, and we are certainly pushing for the best practices, because as you've heard tonight from everyone, our goal is to limit the chance of importing the virus, but more so limiting the chance of community spread. And so we have the testing in place, we have the isolation unit, which we hope we never have to use, ventilators. We certainly waited until we had better capacity for testing and for treating any patients who became so symptomatic that they had to go to the hospital before we went to this. And some people, they ridiculed us for saying we were going to stay closed until at least October 31st. We heard, persons here in Anguilla and around the region were skeptical. But we found that was necessary to help us to get things in place, and now we have more testing capacity. We have a senior lab technician that's come in from England, from Public Health England, to help us with testing. And as we open up to guests, we want to make sure that we do it in a safe manner. And there is still public concern that we shouldn't open at all, and that we should stay with this COVID-free status that we have, having had only 3 cases, and thank God they all recovered. But we do know that as we open, there is a chance that the virus can come in. The protocols we have will limit the ability for it to get out of wherever that person is. And we certainly know that we will always look out the best interests of the people of Anguilla. And this health team on this side, you know, that's our goal, to make sure that we protect the people. But we also know that we have to open the economy so that people can get back to work. You know, it bothers us that our hospitality workers, you know, are at home still. And we do thank the hoteliers for, you know, having the patience, and the villa owners to wait on us. And so we are working with the ports to make sure that the ports are set up so that persons can have physical distancing. They will have to come in wearing masks because that limits the chance as everyone is together flying in or coming in on the boat. And then when they get to their facilities, to the hotels or villas, that they stay in place. The hotels will be their own isolation units. They will be allowed activities. They'll be allowed to go to the beach, but all these will be controlled so that we limit the chance of spread into the community. So I thank you for your understanding, for your patience with us as a government, as a health service, knowing that, you know, tourism is our main industry, but the health of our people is paramount. I thank St. James Medical School for, you know, being a good corporate citizen, being, you know, Anguillian enough to be here to help us with this. There's another seminar on October 29th. And we also know that you can always call any of the professors, call the school, call the public health, call the Ministry of Health, call the tourism. You know, they also know what the protocols are and what the standard operating procedures are. And Ministry of Education and Social Development is represented. The government is open, transparent, accountable, and we'll answer the questions. Also want to thank the governor's office for what they have done for us, because they have bent over backward to make sure we had funding to help to get the hospital to a point where it can be supportive of patients if someone got, the virus got sick enough, for bringing in the testing capacity, for going to CEFID and asking them to specifically make you know, test kits so that Anguilla could benefit from that, which has increased our testing capacity, and also getting the open platform machine that now they've even brought in a lab technician from England to help us. What I want to say though is, you know, if persons don't have to leave Anguilla, we're still asking that you just don't leave, because testing capacity is better, but it's still, there's a limit to it, and we would want to make sure that we can test those who come in to visit. So if it's not an emergency or it's not something that you have to do, stay here in COVID-free Anguilla and enjoy the amenities that persons want to come here to enjoy, rather than just wanting to leave. Somebody asked if they can leave and go St. Martin just for the day. You can leave, you know, but you have to apply to come back in. So it means you can't go for a day. And I thank you again. I thank Dr. Ramirez and Dr. Ilyu. Thank this whole panel, the CMO, Dr. Andrew, and the permanent secretary, Mr. Rogers. He is a doctor, you know. He just doesn't carry the title. And then Minister Deanne Kentish Rogers and Minister Hayden Hughes. And certainly, I know that the good Dr. Liu will see if there are any more final questions and then close it down for us. But thanks again for watching, for listening, for being here. And I thank everyone for participating, because we definitely can only do this with all hands on deck and everybody participating.
Okay, thank you very much. Are there any final questions? No? Anybody from the audience? No. Once again, I want to give a big round of applause to the panel here. All right. Minister Hayden Hughes, who came a little late, Minister Deanne Kentish Rogers, Minister Dr. Ellis Webster, Dr. Aisha Andrewen, and Dr. Forrester, Forrester Rogers. Thank you.